On the Health Watch tonight, there's a new shingles vaccine. Shingrix was approved by the FDA last week, and a CDC advisory panel just voted to recommend it for patients 50 or older. It's given as 2 injections, 2 to 6 months apart, and in studies, it was found to be more than 90% effective. Dr. Mallika Marshall is here, and there's another shingles vaccine, isn't there?
That's right. So there's one called Zostavax, which has been out for more than a decade, but it's not thought to be as effective as this new vaccine. So in fact, experts are recommending that if you haven't been vaccinated, that you get this new vaccine, and even if you've been vaccinated with the old vaccine, that you should still get this vaccine. So anybody who's had shingles, you know you don't want to get it. About 1/3 of Americans do. It's a painful, itchy rash that can sometimes last for weeks. A small percentage of patients can have chronic pain from it. So please, if you're 50 or older, make sure you get vaccinated.
I've seen the commercial where the guy goes to work and his face looks like a side of beef. That shingle, it's horrible.
All right.
You may be seeing the non-GMO label more, and in some surprising places. Of course, genetically modified or GMO foods are typically resistant to insects, disease, or pesticides, but many shoppers want to avoid them. But some companies are feeling pressured to add non-GMO labeling to products that wouldn't be genetically modified in the first place, like kitty litter or condoms. And doctor, non-GMO doesn't necessarily mean that something is healthier.
No, it doesn't. So when we say that things are genetically modified, it means that it's a plant or an animal that's had its DNA changed in a lab. And for some people that sounds really creepy, right? They call it sort of Frankenfood. They think it might be dangerous or it might be harmful to your health. The truth is there's very little evidence that GMO products are any less healthy than non-GMO products, and in some cases they may actually be safer. So just remember, just because something says it's non-GMO or organic or natural doesn't necessarily mean that it's healthier for you. Your best bet is to just look at that nutrition label and decide what ingredients you want.
It's almost become a marketing thing. You slap it on there and it looks like health food, right?
Exactly.
All right, Dr. Mallika, thank you so much. Lisa, over to you.
All right, David, doctor, thank you. David and